Assalamu alaikum. Welcome in my YouTube live. Today topic is let's learn general anatomy. Today topic is about general anatomy. I hope all you are very well and happy in your places and taking part in the development of your country, your region, your province, your state, your city, your family and your home. Who are new on my YouTube channel, please subscribe my channel, like, like, live, and for feedback, write some comments, and you can ask questions to on to the topic disease, how it help medical doctor, medical student to determine about location of disease, the people suffering from disease. Today we will start about nomenclature of anatomy. In 2nd century, Galen wrote his book in Greek, and in 16th century, Vesalius did it in Latin language. Most of the anatomical terms, therefore, are either in Greek or Latin. By 19th century, about 30,000 anatomical terms were in use in the books and journals. In 1895, the German Anatomical Society held a meeting in Basel and approved a list of about 5,000 terms known as Basel Nomina Anatomica. It is called BNA. The following 6 rules were laid down to the following strictly. Number 1. Each part shall have only one name. Number 2. Each term shall be in Latin. Number 3. Each term shall be as short and simple as possible. Number 4. The terms shall be merely memory signs. Number 5. The related terms shall be similar. For example, femoral artery, femoral vein, and femoral nerves. And number 6. The adjectives shall be arranged as opposite. For example, major and minor, superior and inferior. BNA was revised in 1933 by a committee of the Anatomical Society of Great Britain and Ireland in a meeting held at Birmingham. Birmingham. The revised BNA was named as Birmingham Revision BR. An independent revision of the BNA was also done by German anatomist in 1935 and was known as Gina Nomina Anatomica JNA or JNA. However, the BR and INA found only local and restricted acceptance. In 1950, it was agreed at an international congress of anatomists held at Oxford that a further attempt should be made to establish a generally acceptable international nomenclature, and the Sixth International Congress of Anatomists held at Paris 1955. And the third edition of Nomina Anatomica, Edinburgh Jack Mitchell 1968, was published by the Excerpts Media Foundation. Excerpts Excerpta Medica Foundation. The drafts on Nomina Histologica and Nomina Embryologica prepared by the subcommittee of the International Anatomical Nomenclature Committee IANC were approved in a plenary session of the 11th International Congress of Anatomists held in Leningrad in 1970. After a critical revision, the fourth edition of Nomica Anatomica Egan Rogan Warwick 1977 containing Nomica Histologica and Nomica Embryologica was published same publisher by the same publisher. Language of anatomy. Various positions, planes, terms, and relation to various regions and movements are described one by one. For example, we see positions. Anatomical position. It is a specific position in which the person is asked to stand straight. An anatomical position when a person is standing straight with eyes looking forward, both arms by the side of body, palms facing forward, both feet together. The position is anatomical position. It is called anatomical position. He or she not bent any side, straight position. Superior. What is superior position? When a person is lying on his back, arms by the side, palms facing upward, and feet put together. The position is supine position. What is prone position? Person lying on his her face, chest and abdomen is said to be in prone position. Lithotomy position. Person lying on her back with legs up and feet supported in steps. This position is mostly used during delivery of the baby. Planes. A plane passing through the center of the body, dividing it into two equal right and left halves, is the median or media-sagittal plane. Plane parallel to median or mid-sagittal plane is the sagittal plane. A plane at right angle to sagittal or median plane which divide the body into another and posterior halves is called a coronal plane. A plane, another plane, a plane at right angles to both sagittal and coronal planes which divide the body into upper and lower parts is called a transverse horizontal plane. Oblique plane, what is oblique plane? Any other plane older than coronal transversus and mid-sagittal is called oblique plane. Cardinal plane, if any plane transverses the center of the body, it is called cardinal plane. Welcome in my life. Thanks, friends. Nobody is banned. All are allowed to join. Nobody is banned. Don't worry. Some other terms, fundamental positions. It is same as anatomical positions except that palms are facing the body. It is a comfortable position and is not important from anatomy point of view. Center of gravity, the point where three cardinal planes intersect and the body is called center of gravity. Terms used in relation to trunk, neck and face. There are some trunk, there are some terms that are used to explain position of trunk, neck and face. Vertical or anterior is the front of trunk, neck and face. Dorsal or posterior is the back of trunk, neck and face. Medial is a plane close to the median plane. Lateral is plane away from the median plane. Median plane, what is it? Is imaginary a central line which divides the body into two parts. It is called median plane. Proximal cranial superior is close to the head end of body. Distal caudal inferior is close to the lower end of the trunk. Distal or caudal or inferior is close to the lower end of the trunk. Superficial is close to skin towards the surface of body. Deep is away from skin, away from the surface of body. Ipsilateral is on the same side of the body as another structure. Can you understand? Can you hear what I am telling about you? Something? Any voice problem? Voice is okay? Anybody can listen? Contralateral is on opposite side of the body from another structure. Invagination is projection inside. Evagination is projection outside. Okay, thank you for telling me. Terms used in relation to upper limb. Ventral or anterior mean it is the front of body. Dorsal or posterior mean it is the back of body. Medial border mean line along the little finger, medial border of forearm and arm. Lateral border mean the thumb, lateral borders of forearm and arm. And lateral border always follows the thumb, lateral borders of forearm and arm. Proximal mean it is close to root of limb while distal is away from the root. Palmar mean aspect is the front of the palm. जो लोग नए हैं, the people who are new on my live, please like the live. Dorsal main aspect of hands is on the back of palm. Flexor aspect is front of upper limb. Extensor aspect is back of upper limb. Terms used to relation to low limb. Posterior aspect is the back of low limb. Anterior aspect is front of low limb. Medial border lies along the big toe or hallux. Medial border of leg and thigh. Lateral border lies along the little toe, lateral border of leg and thigh. Flexor aspect is back of low limb. Extensor aspect is front of low limb. Proximal is close to the root of limb while distal is away from it. Terms of relation commonly used in embryology and comparative anatomy, but sometimes in gross anatomy, mean big anatomy, big for big structure explanation. Ventral, it mean towards the belly like anterior. Dorsal, towards the back like posterior. Cranial or rostral, towards the head like superior. Caudal, towards the tail. Terms related to body movements. And the body different movements happens to explain an anatomy. There are some specific names. Terms. Movements in general synovial joints are divided into four main categories. Number one, gliding movement. Number two, angular movement. Number three, spatial movements. Number four, rotation. One by one, we discuss about these movements. Number one, gliding movements. Relatively, dead surfaces move back and forth and from side to side while respect to one another. The angle between articulating bones does not change significantly. Number two, angular movements. Angle between articulating bones decreases or increases. And flexion, there is decrease an angle between articulating bones, and in extension there is increase an angle between articulating bones. And lateral flexion is movements of trunk sideways to the right or left at the waist. Adduction is movement of bones toward midline, whereas abduction is movement of bones away from midline. Number three, spatial movements. These occur only at certain joints, for example, pronation, supination, at radioulnar joints, protraction and retraction at temporomandibular joints, inversion and eversion at subtalar joints. Number four, rotation. A bone revolves around its own longitudinal axis and medial rotation. Anterior surface of a bone Anterior surface of a bone of limb is turned toward the midline, and lateral rotation. Anterior surface of a bone of limb is turned away from midline. And upper limb, what happened? Flexion, when two flexor surfaces are brought close to each other, for example, an elbow joint, when front of arm and forearm move close to each other. Extension, when extensor or dorsal surfaces are brought in as much approximately as possible. For example, straight, straight, straighten the forearm at the elbow joint. Abduction of shoulder, when limb is taken away from the body. Adduction of shoulder, when limb is brought close to the body. Flexion of shoulder, if arm is taken toward the front of the chest wall. Extension, extension, arm is taken backward and laterally. Circumduction, it is movement of distal end of a part of the body in a circle. As the name indicates, it is circumduction. It means the movement will be in the circle. A combination of extension, abduction, flexion, and adduction in a sequence is called circumduction, as in bowling. During cricket match, during the bowling, it is happen. Medial rotation of shoulder, जो लोग हमारे लाइव पे आ रहे हैं, प्लीज़ आप कमेंट भी करते रहें ताकि पता चले कौन कौन यहाँ पर हमारे साथ जुड़ा हुआ है. Medial rotation of shoulder, when the arm rotates medially, bringing the flexed forearm across the chest, elbow and contact with trunk. Lateral rotation of shoulder, when arm rotates laterally, taking the flexed forearm away from the body, elbow and contact with trunk. Supination, when the palm is facing forward or upward, as in putting food in the mouth. Pronation, when the palm face backward or downward, as in picking food with fingers from the plate. Adduction of digits or fingers, when all the fingers get together. Abduction, when all fingers separate. The excess of movements of fingers is the line passing through the center of the middle finger. A position of thumb, when tip of thumb touches the tips of any of the finger. In the neck, what are these movements? Flexion, when face comes closer to chest. Extension, when face is taken away from the chest. Lateral flexion when air is brought close to shoulder. Rotation when neck rotates so that chin goes to opposite side. Opening the mouth when lower jaw is lowered to open the mouth. Closure of the mouth when lower jaw is opposite to the upper jaw closing the mouth. Protraction when lower jaw slides forward and the socket and the temporal bones of skull. Retraction when lower jaw slides backward in X socket and the temporal bone of skull. And the trunk, which movements happen backward bending is called extension. It is in the trunk. Forward bending is called flexion. Sideward movement is lateral flexion. Sideward rotation is lateral rotation. Terms used for describing muscles. Origin. What is origin meaning? According to muscle, the end of a muscle which is relatively fixed during its contraction. It is called origin. And insertion, the end of a muscle which moves during its contraction. The two terms, origin and insertion, are sometimes interchangeable when the origin moves and the insertion is fixed. Belly. The flexi and contractile part of a muscle is called belly. What is tendon? The fibrous, non-contractile and cord-like part of a muscle is called tendon. Aponeurosis. What is the flattening tendon is called aponeurosis. Raphe. A fibrous band made up of interdigitating fibers of the tendons or aponeurosis. Unlike a ligament, it is stretchable. Ligament, fibrous, inelastic bands of which connect two segments of a joint. It is called ligaments. Fibrous, it is what is ligament? It is fibrous, inelastic bands which connect two segments of a joint. Terms used for describing vessels. Arteries. What are arteries? Arteries carry oxygenated blood away from the heart. The only exception to this remark is the pulmonary and umbilical arteries which carry deoxygenated blood. Otherwise, all arteries carry oxygenated blood. Arteries assemble trees because they have branches. These are called arterioles. These are like branches. So these are called arterioles. Veins. Veins always carry deoxygenated blood towards the heart. The exception to this remark is the pulmonary and umbilical veins, which carry oxygenated blood. Veins resemble rivers because they have tributaries venules, which are called venules. Veins have valves to allow an indirectional flow of blood. Vena, vena comitatis are two veins, one on each side of a mid, medium-sized artery of a limb joined to each other across the artery. Capillaries are networks of microscopic vessels connecting arterioles to venules. Sinusoids are large, irregular vascular space which are closely surrounded by the parenchyma of the organ. These are seen in liver, spleen, bone marrow, suprarenal glands, parathyroid glands, etc. Anastomosis. Anastomosis are precapillary or postcapillary communications between the neighboring vessels. Terms used for the describing bone features. For example, bone marking and what are their examples. For example, we see linear elevation, line. What is line? Line means superior nuchal line and inferior nuchal lines of the occipital bone. Crest. What is crest? The iliac crest of the hip bone of spine of scapula ridge. The medial and lateral supra, supracondyle ridge of the humerus. Rounding elevation. Tubercle. What is tubercle? Pubic tubercle, lesser and greater tubercles of humerus bone. Protubercle, external occipital protubercles. Tuberosity, ischial tuberosity of the hip bone. Deltoid tuberosity. Malleus, medial malleus of the tibia, lateral malleus of the fibula. Trochanter, greater and lesser trochanter of the femur bone. Sharp elevation, supine or spinous processes. Ischial spine of vertebra, anterior superior processes, iliac spine. Styloid process of templar bone. Standing ends are for articulation. Head, head of humerus, head of femur, head of radius. Condyle, medial and lateral condyles of femur, kunchal-like processes. Epicondyle, medial and lateral epicondyle of femur bone. Prominence situated just above condyle. Medial and lateral epicondyle of humerus. Small flat area of articulation. छोटी जगह, छोटे एरिया जो आर्टिकुलेट होता है, मिल जाता है बोनों के साथ, बहुत छोटा एरिया होता है, वो कहाँ कहाँ पर पाया जाता है, कहाँ कहाँ मिलता है, हम वो उसको देखते हैं. Facet, facet on head of the rib for articulation with vertebral body. Depression, notch, greater scatic notch and lesser scatic notch of hip bone. Groove or sulcus, bicipital groove of humerus. Fossa, radial and coronal fossa of humerus. Acetabular fossa of hip bone. Water opening in the bone. Fissure, superior orbital and inferior orbital fissures. Foramen, infraorbital foramen of the maxilla. Canal, carotid canal of templar bone. Meatus, external acoustic meatus and internal acoustic meatus of templar bone. Systems of the body. And the body, how many systems mostly work? The study of anatomy can be divided into the following 12 major body systems. The body systems influences one in another and work interdependently and independently to maintain health. These are as number 1, respiratory system. It is also called pulmonology. Number 2, articular system mean arthrology. Muscular system, number 3. Number 4, circulatory system mean angiology. Number 5, lymphatic system. Number 6, skeletal system mean osteology. Number 7, in integumentary system mean dermatology. Number 8, digestive system, gastroenterology. Number 9, urinary system, urology. Number 10, reproductive system, andrology. Number 11, endocrine system, endocrinology. Number 12, Spatial senses. One by one, we will discuss about all these systems. Systems of the body. Number one, respiratory system. It is also called pulmonology. Consists of nose, nasopharynx, larynx, trachea, bronchi, bronchioles, alveoli, and the diaphragm. These structures receive oxygen to oxygenate the venous blood and help an elimination of carbon dioxide from the blood. Number two, articular system main arthology comprises various joints with their ligaments. Various types of movements take place at the synovial joints, cartilaginous and fibrous joints are for growth of the bones. The joints provide integrity and stability to the adjoining bones and some forms cavities for protection of organs. Number three, muscular system is the system which moves the various joints of the body and is responsible for activity, locomotion, and facial expression. For example, frontalis muscle, orbicularis oculi, orbicularis oris. Number four, circulatory system mean angiology comprises cardiovascular system which consists of heart and blood vessels, include arteries, veins, and capillaries. Blood supplies nutrients and oxygen to cells and take away carbon dioxide and wastes and wastes from cells and helps to regulate acid-base balance, temperature, and water content of body fluids. Blood components help to defend against diseases and disease causing organisms. Number five, lymphatic system. Lymphatic system consists of various lymph vessels which withdraw excess tissue fluid with macromolecules, filters it through lymph nodes and returns it to the venous system. Skeletal system main osteology consists of numerous cartilage and bones providing support and symmetry to the body. Cartilage keeps the respiratory pathways pa- pathways patent. Bones being the largest storehouse of calcium provide attachment to numerous skeletal muscles for locomotion. Bones also make cavities or cage for protection of organs like brain, heart, lungs, and reproductive organs. Number 7, integumentary system mean dermatology. Dermatology consists of the skin with its various appendages like hair, sweat glands, sebaceous gland, and nails. Skin is the outermost protective and sensitive covering of the body. Number 8, digestive system or gastroenterology comprises various organs associated with ingestion, mastication, deglutition, digestion, and absorption of food components. This system also eliminates the solid waste from the body through the anal canal. It is made up of a long tube from mouth to the anus and various associated glands like salivary glands, liver, gallbladder, pancreas, gastric, and intestinal glands. It is our area is called GIT, gastrointestinal tract. Number 9, urinary system urology helps in excretion of liquid waste from the body. This system comprises kidneys, urethra, urinary bladder, and ureters. Urinary system consists of kidneys, ureters, urinary bladder, and urethra. The kidneys filter the blood and produce, transport, store, and expel the urine at frequent intervals. Number 10, reproductive system. It is also called andrology in males and gynecology in females. Consists of different organs in males and females. In males, there are testes, epidermis, vas deferens, ejaculatory ducts, urethra, prostate, seminal vesicles, and penis. But in the female, these are different. And female, the organs are ovarian, fallopian tubes, uterus, and vagina. These two sets of organs are responsible for the production of ova and spermatozoa, which on fertilization, implantation, and proper nourishment, and the uterus develops into a fetus. The fetus delivers out after 9 months of pregnancy in the form of a baby, boy baby or girl baby. Number 11, endocrine system endocrinology consists of ductless glands like hypothalamus, physics, cerebri, thyroid, parathyroid, suprarenal glands, and islets of Langerhans and pancreas, which produce hormones that are carried to various target organs via bloodstream. In male, additional endocrine glands is testis, whereas in females it is replaced by ovary. These hormones influences metabolism and other processes like production of spermatozoa and the menstrual cycle. Special senses number 12. Special senses include sense of taste, sight, smell, hearing, balance, and touch. Taste is appreciated by the papillary present and the tongue, epiglottis, and soft palate. Sense of sight is appreciated and the nervous layer, the retina of the eyeball. Receptors of smell are only present in the mucous membrane of the upper part of the nasal cavity. Hearing and balance are completely organized in the internal ear. Touch is perceived through the skin. Number 13, nervous system. It is also called neurology. Neurology. It consists of billions of neurons included in the central nervous system, brain and spinal cord, and peripheral nervous system, cranial and spinal nerves. This is the system which controls the whole body, including its muscles, glands, and organs. The nervous system controls both our voluntary and involuntary activities. The personality of the person is depending on the integrity of the nervous system. The details it will be discussed later. Clinical anatomy. The suffix itis means inflammation. For example, appendicitis, tonsillitis, arthritis, neuritis, dermatitis. जब एंड में किसी भी डिजीज के एंड में द वर्ड itis आएगा तो दिस मीन देयर इज ए इन्फ्लेमेशन swelling. The suffix mean the word which is used and the end of some disease, some words It is called suffix. The suffix दो होते हैं, एक होता है लायक, एक होता है साबका। सुफिक्स क्या होता है? वो साबका होता है, यानी जो अल्फाज है उसके एंड में यूज़ करते हैं सुफिक्स। द सुफिक्स इक्टोमी, इक्टोमी मीन्स रिमूवर फ्रॉम द बॉडी। इक्टोमी, जैसे फॉर एग्जांपल अपेंडेक्टोमी, आपने सुना होगा वर्ड अपेंडेक्टोमी, यानी उसके क्या होते हैं, उस पेशेंट की अपेंडिक्स निकाली दी जाती है। टॉन्सिलेक्टोमी, यानी उसके टॉन्सिल वगैरह निकाल दिए जाते हैं। गैस्ट्रेक्टोमी, नेफ्रेक्टोमी etc. The suffix atomy means to open and then close a hollow organ. For example, laparotomy, hysterectomy, cystotomy, cystolithotomy. The suffix ostomy means hollow organs and have it open. For example, cystotomy, colostomy, tracheotomy. The suffix oma means a tumor. For example, lipoma. Osteoma, neurofibroma, hemangioma, carcinoma, for example. Puberty, the age at which the secondary sexual characters develop, being 12 to 15 years in girls and 13 to 16 years in boys. Symptoms are subjective complaints of the patient about his disease. सिम्पटम का मतलब होता है कि पेशेंट अपनी बीमारी के बारे में आपको कुछ बताएगा। सिम्पटम मीन से, सिम्पटम, ही और शी विल से टेल यू, एक्सप्लेन यू, ही और शी विल इन्फॉर्म यू, टेल यू सम स्टोरी अबाउट डिजीज, इट इज कॉल्ड सिम्पटम। एंड साइन, वो चीज़ें जो आप पेशेंट की बॉडी पर देखते हो, फ्रैक्चर का निशान, किसी जानवर के बाइट का निशान, या कोई किसी चीज़ की मदद से उसको मारा पीटा गया उसका निशान, या किसी इंजरी का निशान, किसी एक्सीडेंट का निशान, या कोई फ्रैक्चर का निशान होता है, उसको बोलते हैं साइन, जो आप अपनी आंखों से पेशेंट की बॉडी पर देखते हो खुद बाई सेल्फ। साइंस मीन फिजिकल साइंस और ऑब्जेक्टिव फाइंडिंग ऑफ द डॉक्टर ऑन द पेशेंट बॉडी। डायग्नोसिस, identification of a disease or determination of the nature of a disease. Prognosis, forecasting the probable course and ultimate outcome of a disease. Pyrexia mean fever. Lesion mean injury or a circumscribed pathologic changing in the tissue. It is called lesions or injury. Inflammation, it is the local reaction of the tissues to an injury or an abnormal stimulation caused by a physical, chemical, or biological agent. It is characterized by number 1, swelling, pain, redness, warmth or heat, loss of function. 1 2 3 4 5 5 characters will be found: swelling, pain, redness, heat or warmth, loss of function. Edema. What is edema? Swelling due to accumulation of fluid and the extracellular space. It is called edema. Thrombosis. Intravascular coagulations, solidification of blood. Embolism. Occlusion of a vessels by a detached and circulating thrombosis, embolus, also called. Hemorrhage. Bleeding which may be external or internal. Sometime ब्लीडिंग हो जाती है बॉडी के अंदर किसी वजह से, किसी इंजरी की वजह से या अंदर कोई रप्चर की वजह से, ऑब्सेशन की वजह से, इट इज कॉल्ड हेमरेज। एक्सटर्नल भी हो सकती है और इंटरनल भी हो सकती है। अल्सर, a localized breach, gap, erosion and the surface continually of the skin or mucous membrane. It is called ulcer. Duodenal ulcer, for example, gastric ulcer, ये उसकी एग्जाम्पल हैं, मिसाल हैं। Sinus, a bleeding crack open at one end lined by epithelium is called sinus. Fistula, an abnormal passage usually between two internal organs or organ to surface of the body and lined by epithelium. It's called fistula. Mostly anal fistula. It is common disease. Necrosis, local death of a tissue or organ due to irreversible damage to the nucleus. The degeneration, a retrogressive change causing deterioration in the structural and functional qualities. It is a reversible process but may end in necrosis. Gangrene, a form of necrosis, death, combined with putrefaction, infarction, death, necrosis of a tissues due to sudden obstruction of X artery of supply, often an end artery. Atrophy. What is atrophy? Diminution in the size of cell, tissue, organ or a part due to loss of X nutrition. It is called atrophy. Dystrophy, diminution in the size due to defective nutrition. Hypertrophy, hyper mean high, increase, बढ़ जाना साइज में, increase in the size without any increase in the number of cells. Atrophy mean absent, hyper mean increase. Hyperplasia, increase in the size due to increase in the number of cells. Hyperplasia. Hypoplasia, incomplete development. Aplasia, failure of development. A mean absent. Syndrome, a group of diverse symptoms and signs contributing together the picture of a disease. What is syndrome? A group of diverse symptoms and sign and symptom constituting together the picture of a disease. Paralysis, fallige, loss of motor power movements of a part of body due to denervation or primary disease of the muscles. It is called paralysis. Hemiplegia, paralysis of one half of the body. Paraplegia, paralysis of both the lower limb. Monoplegia, paralysis of any one limb. It is called monoplegia. Mono mean one, di mean two. Quadriplegia, paralysis of all the four limbs. It is called quadrants mean four, चार हिस्से. Anesthesia, loss of sensation. Anesthesia. Analgesia, loss of the pain sensibility. Thermoanesthesia, loss of the temperature sensibility. Hyperanesthesia. Hyperanesthesia. What is hyperanesthesia? It is abnormally increased sensibility. Paraesthesia, perverted feeling of sensations. Coma, deep unconscious form is called coma. We say the patient is in the coma condition. What is coma? Deep unconscious form. Tumor neoplasm, a circumscribed non-inflammatory abnormal growth arising from the body tissue. Benign, mild illness or growth which does not endanger life. Malignant, severe forms of illness or growth which is resistant to treatment. Carcinoma, malignant growth arising from the epithelium, ectoderm or endoderm. Sarcoma, malignant growth arising from connective tissue, mesoderm. Cancer, a general term used to indicate any malignant neoplasm which shows invasive invasiveness and results in death of the patient if not properly treatment. Metastasia, spread of a local disease like the cancer cells to distant part of the body. Convalescence, the recovery period between the end of a disease and restoration to complete health. Therapy, the treatment of disease is called therapy. Arrangement of structures and the body from within outwards. Let's see this new things. Arrangement of structures एंड द बॉडी, जिस्म के अंदर जो ये पूरे बॉडी सिस्टम है वो किस तरह एक तरतीब में जुड़े हुए हैं, किस तरह एक तरतीब में आप एक दूसरे के साथ अटैच हैं, उसको हम लोग अभी चेक करेंगे. बोन्स फ्रॉम द सपोर्टिंग framework of the body. Muscles are attached to bones. Blood vessels, nerves, and lymphatics from neurovascular bundles which course in between the muscles along the facial planes. इसके अंदर in this topic we will look how our body is arranged, how our body is in a beautiful shape. The thoracic and abdominal cavities contain several internal organs called viscera. The whole body has three general coverings, namely number one, skin, superficial fascia, and deep fascia. The whole body has three general covering. What they name? Number one, skin. After skin, there is a superficial fascia, and the third is deep fascia. Points to be remember what these are. These are now Hippocrates. Hippocrates is the father of medicine. Leonardo da Vinci is the founder of modern anatomy. Dr. Indrajit Diwan researched on osteology and anthropology. Anatomical position is the most important position for understanding anatomy. Median plane is only one plane and the trunk. Pronation and supination of forearm are special movements which permit picking up of food. Pronation and putting it in the mouth is supination. Big toe being in the same plane as rest of the toe is unique to human. Inversion and eversion of the foot help its adjustment to the rough ground. There are 12 systems in the body. Medical students learn anatomy as regional anatomy, whereas nursing students learn it as system anatomy. Median Mid-sagittal plane divides the body into right and left halves. Coronal plane divides the body any any part into anterior and posterior parts. Transverse or horizontal plane divide the body parts into upper and lower portions. अब हम थोड़ा सा इसमें कुछ चीज़ें देखेंगे. What we will see, we will revise what we learn in this topic. MCQ mean multiple choice question. MCQ. Name of the founder of modern anatomy. Number 1, Vesalius. Number 2, Herophilus. Number 3, Galen. Number 4, Leonardo da Vinci. Number second question. Name the father of medicine. Herophilus, Galen, Hippocrates, or Vesalius. Name the father of anatomy. Henry Gray, Hippocrates, Galen, Herophilus. You can also write answer of this question in the comment and the chat. Phylogeny is the developmental history of a human through evolution, through life before birth, from birth to death. Any student can give answer of these MCQ by chatting, by sending message. Ontogeny is the developmental or history of a human. Number 1, through evolution before birth, from fertilization till death after birth. Number 6, anatomical position has following features except person standing erect, forearm are pronated, feet together, eyes looking forwards. Which statement about the coronal plane is incorrect? Number 1, coronal plane divides the body into anterior half and posterior half. Lies at right angle to sagittal plane. Lies at right angle to transverse plane. Divides the body into right half and left half. What is abduction? Define abduction. Movement away from center axis, movement towards center axis, approximation of the ventral surfaces, approximation of the dorsal surfaces. What is the position of forearm and the anatomical position? Pronated, supinated, mid, prone, none of the above. Plane at right angle to the long axis of body or body parts is called sagittal, coronal, transverse, horizontal, or oblique. The term cranial means towards the head, towards the back, towards the tail, towards the front. Number 12, periaxial border of upper limb is X inner border, X outer border, X anterior median line, X posterior median line. So guys, you can give also answer by sending message if you remember. After 5 minutes, I will inform you the correct answer. You can write and send message what you understand, which are correct answer according to you. You have 5 minutes, you can give answer. After 5 minutes, I will inform you correct answer. I hope you remember everything which was discussed in first and second lecture. Very easy things, common way it was discussed, basic things of anatomy. It was anatomy definition, anatomy history, anatomy branches, how anatomy evolved, how evolution occurred in the anatomy, and which period what happened, which persons contribute to development and the anatomy. It was discussed, and also it is what told anatomical nomenclatures and which country contribution and language of anatomy also discuss positions and also discuss terms used and relation to different parts of the body. Terms related to body movements it was also discussed. And upper limb, lower limb, head, neck. So correct answer are coming to you. MCQ number 1. Name the founder of modern anatomy. The correct answer is Leonardo da Vinci. Name the father of medicine. The correct answer is Hippocrates. Name the father of anatomy. The correct answer is Herophilus. Phylogeny is the developmental history of a human. The correct answer is through evolution. Ontogeny is the developmental history of a human. The correct answer is from fertilization till death. Anatomical position has following features except. The correct answer is forearms are pronated. Which statement about the coronal plane is incorrect? The correct answer is divides the body into right half and left half. Define abduction. The correct answer is movements away from center axis. What is the position of forearms and the anatomical position? The correct answer is supinated. Plane at right angle to the long axis of body part is called. The correct answer is transverse or horizontal. 11. The term cranial means. The correct answer is towards the head. Periaxial border of upper limb is. The correct answer is at its outer border. I hope you learned many things. And first topic, I again revise our topic for students who were not present in the first lecture. It is a basic of anatomy introduction. What is anatomy? Human anatomy is the science which deals with the structure of the human body. The term anatomy is derived from a Greek word anatome, meaning cutting up. The term dissection is a Latin equivalent of the Greek anatome. However, the two words anatomy and dissection are not synonymous. Dissection is a mere technique, whereas anatomy is a wide field of study. Anatomy forms firm foundation of the whole art of medicine and, and introduce the student to the greater part of medical terminology. Anatomy is to physiology, as geography is to history. It describes the theater in which the action takes place. Anatomy is divided into different branches. Initially, anatomy was studied mainly by dissection, but the scope of modern anatomy has becomes very wide because it is now studied by all possible techniques which can enlarge the boundaries of the anatomical knowledge. The main subdivision of anatomy are with the naked eye, macroscopic or gross anatomy. This can be done by one of the two approaches. Number one, in regional anatomy, the body is studied in parts like the upper limbs, lower limb, thorax, abdomen, head and neck, and brain. Number two, in systemic anatomy, the body is studied in systems like the skeletal system. It is also called osteology, muscular system. It is called myology, articular articulatory system, arthology, or syndesmology, vascular system. It is called angiology, nervous system, neurology, and respiratory, digestive, urogenital, and endocrine systems. Suprachincology. The locomotor system include osteology, arthology, and mycology. These systems are briefly living anatomy is studied by inspection, palpation, percussions, auscultation, endoscopy, bronchoscopy, gastroscopy, radiography, electromyography. Embryology or developmental anatomy is the study of the prenatal developmental changes in 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 an individual's. The developmental history is called oncogeny. The revolutionary history, on the other hand, it is called phylogeny. Histology or microscopic anatomy. As the name indicates, it is the study of tissue, a study of structures with the aid of a microscope. Surface anatomy, topographic anatomy is the study of deeper parts of the body in relation to the skin surface. For example, palpating the artery. It is helpful in clinical practice and surgical operations. For example, palpating the artery. Radiographic and imaging anatomy is a study of the bones and deeper organs by plain and contrast radiography, by ultrasound and computerized tomography यानी मेन सीटी स्कैन and magnet resonance MRI image. Comparative anatomy is the study of anatomy of the other animals, so explain the changing in form, structure and function. Morphology of different parts of the human body. Physical anthropology deals with the external features and measurements of different races and groups of people, and with the study of the prehistoric remains. It indicates the evolution history of a person, like the scientist Charles Darwin worked on this so much. Number 9, applied anatomy. Clinical anatomy deals with application of the anatomical knowledge to the medical and surgical practices. Number 10, experimental anatomy is the study of the factors which influence and determine the form, structure, and function of different parts of the body. Number 11, genetics deals with the study of information present in the chromosomes. What is the history of anatomy? How anatomy evolved? What changing happened? One region to other region. Number 1, Great Period BC, before birth of Christ, Hazrat Islam. Hippocrates of Kos, circa 400 BC, the father of medicine, is regarded as one of the founder of anatomy. Parts of Hippocrates' collection are the earlier anatomical description. Herophilus of Chalcedon, circa 300 BC, is called the father of anatomy. He was a Greek physician and was one of the first to dissect the human body. ये पहले इंसान थे जिन्होंने एक ह्यूमन बॉडी को काटा था. रोमन पीरियड AD, after death of Hazrat Islam. Galen of Pergamum, Asia Minor, circa 130 to 200 AD. The prince of physicians, practices medicine at Rome. He was the foremost practitioner of his days and the first experimental physiologist. 14th century Mundins on Mondino A.D. di Luzzi. 1276 to 1326. The restorer of anatomy was an Italian anatomist and professor of anatomy at Bologna. Number 4. 15th century, what happened? What contribution happened? Leonardo da Vinci of Italy. 1452 to 1519. The originator of cross-sectional anatomy was one of the greatest geniuses the world has known. He was the father of modern anatomy. Number 5. 16th century Vesalius Vesalius 1540 15 to 64. The reformer of anatomy was German in origin, Belgian Brussels by birth, and found an Italian Padua University favorable for his work. He was professor of anatomy at Padua. Number 6. 7th century, what happened? Williams Harvey 1578 to 1657 was an English physician who discovered the circulation of blood and published it as anatomical exercise on the motion of the heart and blood in animals. He also published a book on embryology. 18th century William Hunter 1718 to 1783 was a London anatomist and obstetrician. He introduced the present day embalming with the help of Harvey's discovery and founding with his younger brother, and the founded with his younger brother John Hunter the famous Hunterian Museum. In 19th century, what happened? This was the century so many things discovered. The session by medical student was made compulsory in Edinburgh 1826 and Maryland 1833. Berkey and Hare scandal of 16 murders took place in Edinburgh in 1828. Warburton Anatomy Act 1832 was passed in England, under which the unclaimed bodies were made available for dissection. The act was passed in America, Massachusetts in 1831. Formalin was used as a fixative in 1890. Formalin is a chemical which preserves the dead bodies for a long time. It is also used some food product as a preserver. Formalin. X-rays were discovered by Rotterdam in 1895. The noted anatomists of this century included Ashley Cooper, British surgeon, 1768 to 1841; Cuvier, 1769 to 1832; French naturalist Mitchell, 1724 to 1774; German anatomist and Henry Gray, 1827 to 1868. Henry Gray is a very famous due to his book, the author of Gray's Anatomy. It is called Gray's. It is also called the book. The book is also called Bible of Anatomy. 20th century, what happened? The electron microscope was invented in 20th century. It was applied in clinical practice, which made stall, stalling, changing, and the study of normal and diseases condition. Besides plain X-rays, in this century, ultrasonography and echocardiography were discovered. These were the non-invasive safe procedures. Also, computer axial tomography or CT scan, a non-invasive procedure, and magnetic resonance imaging MRI were devised. 21st century, fetal medicine is emerging as a newer subject. Even treatment and utero is being practiced in some cases. Human genome has been prepared. New research and drugs for many diseases, especially AIDS, is being done very enthusiastically. There is also a strong possibility of gene therapy. Indian anatomist Dr. Inderjeet Diwan worked chiefly on osteology and anthropology. Dr. D.S. Chaudhary did notable work on cardio and carotid body. Dr. H. Chatterjee and Dr. H. Verma researched on embryology. Dr. S.S. Dayal did good work in cancer biology. Dr. Shamir Singh and his team did pioneered work on teratology. Dr. Chatur Vedi's and Dr. C. D. Gupta's prominent work was on frozen cast. Dr. L. V. Chakko, Dr. H. N. Kiswani, Dr. Veena B.G. Lani, Dr. Gopinath, Dr. Shashi Vadhva of All India Institute of Medical Sciences, New Delhi, researcher on neuroanatomy. Dr. Kiswani and his team established Museum of History of Medicine. Dr. A.K. Sushila of IIMS New Delhi has done profound work on fluorosis. Dr. M.K. Vadia and Dr. N.K. Mehra are well known for their work on leprosy, HLA, and immunology. Dr. I.B. Singh of Rohtak did enlightening studies on histology. He has been author of several books on anatomy. Dr. A.K. Dutta of West Bengal has authored many books on anatomy. Women's the medical educationists are Dr. Sita Achaya, Dr. Ved Prakash, Dr. Basu, Dr. M. Kaul, Dr. Chandrama Anand, Dr. Indra Bhal, Dr. Savana Bhardwaj, Dr. Riva Chaudhary, Dr. Samita Kakar, Dr. Anita Tuli, Dr. Shashi Raheja, Dr. Ram Prakash, Dr. Veena Bahari Hoki, Dr. Madhur Gupta, Dr. Neelam Vasudeva, Dr. Sabita Mishra, Dr. Raj Mehra, Dr. Rani Kumar, Dr. Satyam Khari, Dr. A.K. Srivastava, Dr. J.M. Kaul, Dr. Shipa Dr. Shipra Paul, Dr. Dhara Dhara Dhramna Yara, Dr. A.C. Das, Dr. A. Halim, Dr. D.R. Singh, and many others. Dr. Harish Agarwal, an anatomist, worked in jurisprudence for a number of years. Dr. Cooper of Chennai, Dr. M. Thomas, and Dr. Kiran Kurchiria did commendable work on genetics. Dr. Mehdi Hassan and Dr. Nafis Ahmad Faruqi did pioneering research in neuroanatomy. Dr. Balas Bala Subramaniam is a computer anatomist. I hope you understand everything which were discussed today. If you have any doubt, you can ask question about today's topic. I hope all you are very well and happy in your places and taking part in the development of your country, your region, your province, your state, your city, your family, and your home. who are new on my YouTube channel, please subscribe my channel, like my live, and for feedback write some comments and press the bell icon, and you can ask questions on today topic if you have any doubt about today topic. Yes, if you have any question you can ask me. Yes, hello. Yes, how are you? I hope you are very well. Violenta is here. Please type and tell about. Today our topic was about general anatomy, anatomy history, anatomy nomenclature, and some clinical things were discussed today. I am also good. Thank you. Welcome. Yes, of course. It is thanks God Allah who give us another day. It is good you are good. How is life going on? Violeta, where are you from? Can you write where are you from? Violeta, where are you from? Can you hear me? Where are you from? Different video. How are you? Oh, you are from Ukraine. Okay, this is good. Oh, okay, okay. I understand, understand. Yeah, nice. Thank you. You come and my live. Yes, every day from 10 to from 10 it is start, and sometime go to 12 o'clock or more. How are condition in Ukraine? I hope Ukraine is very peace there and you are enjoying there and life is very good. Good. You also can bring your friends to come in our live. Okay, it is okay, no problem. 50-50 sometime, and different countries happen sometime, but we should always think positive and always think hope they and the world, every country will be in peace. Ukraine is very famous country in the world and very developed area in the world. Very beautiful people live there, and very beautiful education, very good high education. Many students India and from Pakistan and other countries go there for medical education and also technical. Ukraine's beautiful place. there is very beauty and natural green. People are also good, kind. Ukraine cave, the capitalist cave, is very famous in the world for good development, beauty. People are very happy there. It is so good that Ukraine people always work hard and hospitable. They show very hospitality and kind heart, always help, and very beautiful and loving people of Ukraine. This is so good, and I hope your studies very well, and your family, your mom, your father, and your all your relatives and your friends are very well and very happy. What is time? Yes, all good. Welcome, welcome, welcome. I hope. What is time and this time? What is time and Ukraine now? In Kyrgyzstan, the no time is about 12 half 28. And what is the time in Ukraine this time? Oh, this mean okay, okay, understand, understand. PM. Bora. So there is a 9 o'clock, 9 o'clock in Ukraine. Now that's Bora. The Kyrgyzstan time is 3 hours forward. Good. This is good. Every day you come and also bring your friends. Every day medical class. I hope you will get so many knowledge, so many information about health, about medical, and every day different topics are discussed. Sometime hospital treatment, sometime anatomy, sometime surgery, sometime different pathology, different topics. So please come every day with your friends. Thank you. Yes, it is. Yeah, it is too good. Okay, no problem. Thank you. Yes, and by joining my live, your Ukraine friends also can improve their English. Here is a, also you can practice English also. We can talk English. By this way, your English will be more and more better every day. You come here with your friends and you will, inshallah, learn so many things. who are present here, please comment, give some feedback, so understand who is from you. Every person can write, where are you from? All friends, please write, every person. One of our friends is from Ukraine. Other friends from where? Please write, where are you from? What you do and your daily life, and what is your education? You are a student, or you are a worker, or you are some company boss, chief, CEO, or you are work as a doctor. Where are you from? Please write, everyone, where are you from? Here in my life, so many students present, they are from different parts of the world. So please write, where are you from and what you do and daily life. And also write today about today topic. How was topic? What things you learned today? Please like the live. Every friends, please like the live and give some comments and tell where are you from, what you do, what you like, what is your profession. Are you a doctor? Are you a student medical? Or if you are doctor, you are doctor of which specialist, which category? If you are a student, which year, what is your subject and which year you study? Please give comments, every student, every person. Introduce yourself. Where are you from? What you do? Hello. Right, everyone. Introduce yourself. Where are you from? What you do? Which country you belong? Please write, everyone. Which country you are from? What you do? What is your profession? Please write, everyone. Please introduce yourself. Write in the comments. Where are you from? What you do? What you study? In which college you study? Please write, everyone. Introduce yourself. Who is present with us? Express yourself. Where are you from? Every day, please come with your friends. Every day, we discuss some topic of medical, sometime anatomy, sometime history taking, sometime surgery, sometime pathology, sometime emergency medicine, sometime radiology. sometimes microbiology, sometimes dermatology, ophthalmology, physiology, pharmacology, forensic medicine, biochemistry, internal medicine, anesthesia, sometimes pediatrics, sometimes biochemistry, immunology, sometimes parasitology. So please bring your friends. Oh, good. Yes, understand. One student say, for example, I finished my second year studies to become an archival librarian. Librarian. Oh, good. This is good. Yes, we should love, we should care books. Books give us knowledge. It is so good profession to help pupils to develop our country, to develop our area, develop our society. Librarian is a so nice profession. Yes, very good. You very hard work, student. Here are good students present today in my life from different countries. They are like a flowers. And the garden when we go, there are different types of flowers are moving like this. And in my life, different friends come from different countries to learn many things. Mostly belong to medical subject. Some are librarian. Of all, I consider it as an education and then as a profession. Yes, that's a good idea. First we complete our study, then we choose as a our profession. Yes, you are good thinking. You write good. We should be first we study completely, then we should choose as a our profession. Good, you say. You are very good student. You are a good person. Nice thinking. Please introduce yourself and every friends like the live and write comment and give for feedback. Don't be shy for writing message, comments, write comments for feedback, what you learn in this lecture. I hope all you are very well and happy in your places and taking part in the development of your country, your region, your province, your state, your city, your family, and your home. Who are new on my YouTube channel, please subscribe my channel, press bell icon, like, live, and for feedback, write some comments, and you can ask questions through on today topic. If you have any doubt about today topic and which topic you like, you can also suggest. Next time, these topics will be discussed in this lecture and this live program and these classes. You can suggest which topic you like. Come and my live every day about 10 o'clock. It start medical different topics are discussed. For example, anatomy, physiology, biochemistry, microbiology, embryology, pathology, medicine, ophthalmology, surgery, ENT, dermatology, pediatrics, gynecology and obstetrics, pharmacology, parasitology, and which topic you want discuss. You can also give suggestion. Next time we will discuss on that topic which you like most. There are many subject and the medical, radiology, nuclear medicine we can also discuss one day. Chemotherapy, cancer therapy, genetics, gene therapy, alternative medicine, traditional medicine we can also discuss. But first we should focus on anatomy topic. So if we command on anatomy, you can become a very good physician, you can become a very good surgeon, you can very big professional physician. Please introduce yourself. Where are you from? Every friend tell who is here present and where are he. Please introduce yourself. Please introduce yourself. Who are new on my life? Which friends? Where are you from? What you do? What you like? Where you study? In which maker college you study? Please inform what you like. Hello. Introduce yourself. Who are you? Where are you from? What you do? What you like? Okay, thank you for coming in my life. Good good night. Take rest. Sweet dreams. Who are new? Please introduce yourself. Where are you from? What you do? What you like? Every day, please come on my live. We discuss every day different medical topics, medical subject, anatomy, physiology, biochemistry, pharmacology, pathology, histology, parasitology, pediatrics, surgery, dermatology, clinical tips are given how to take history of a patient about and also medicine, anesthesia, emergency medicine, radiology, nuclear medicine also will be discussed here and coming soon. In coming days, nuclear medicine, cancer therapy, gene therapy, genetics, alternation medicine, TCM also will be discussed here. Please introduce yourself. Who are you? Where are you from? What you do? In which mega college you study? Anatomy is the basic subject in medical education. Improve your knowledge. Read more books for get more information about body, body structure, body function, body deformities, body diseases. As a doctor, as a medical student, it is our duty to get more and more information. Every day we discuss different subject, different topics every day. Sometime orthopedic, sometime clinical methods and examination, sometime bedside technique, history taking. Today was anatomy, general anatomy topic. We discuss anatomy definition, anatomy history, and contribution of different pupils and different periods of time. And we also discuss today terms related for explain body conditions, different diseases. We also discuss movements of body parts. We also today discuss about terms that related to movements of the body, movements, different terms used in embryology or gross anatomy. We also discuss about language of anatomy, for example, anatomical position, spine position, prone position, lithotomy position. We also discuss about planes, oblique plane, cardinal plane, median plane, sagittal plane, corner plane, horizontal plane. We also discuss about fundamental positions, center of gravity. We also discuss today class terms used in relation to trunk, neck, and face. Terms used in relation to upper limb. Terms related to low limb. We also discuss terms of relation commonly used in embryology and comparative anatomy that are mostly used in gross anatomy. We also discuss body movements terms, for example, gliding movements, angular movements, special movements, rotations in upper limb, which movements happen. We discuss, for example, flexion, extension, abduction of shoulder, adduction of shoulder, flexion of shoulder, extension, circumduction movements, medial rotation of shoulder, lateral rotation of shoulder, supination, pronation, adduction of digital or fingers, adduction of digits mean fingers, abductions, opposition of trunk, circumduction of trunk, flexion of trunk, extension of trunk, abduction of trunk, adduction of thumb, flexion of wrist, extension of wrist, flexion of metacarpal phalanges and intermetaphalangeal joints, extension of metacarpal phalanges and interphalangeal joints. And lower limb, which movements we discuss, flexion of thigh, extension of thigh, abduction, adduction, medial rotation, lateral rotation, circumduction, flexion of knee, extension of knee, dorsiflexion of foot, plantar flexion of foot, inversion of foot, eversion of foot. In the neck, we discuss flexion, extension, lateral flexion, rotation, opening the mouth, closure of the mouth. In the trunk, which movements we discuss extension, flexion, lateral rotation. Muscles movements we discuss origin terms used to explain about muscles. Origin, insertion, belly, tendon, aponeurosis, raphe, ligaments. We also discuss about vessels, arteries, veins, venae, contes, capillaries, sinusoids, anastomosis. We discuss. We also discuss about bone features, bone related features. We also discuss about system of the body, for example, respiratory system, which is also called pulmonology, articular system, also called arthology, muscular system, circulatory system, also called angiology, lymphatic system, skeletal system, also called osteology, in integumentary system, also called dermatology. Digestive system, also called gastroenterology. Urinary system, also called urology. Reproductive system, also called embryology in males, and in female it is called gynecology. Endocrine system, also called endocrinology. Special senses nervous system, also called neurology. We discuss today and topic, and also we clinical anatomy we discuss. Okay, thank you for coming here. Allah, God bless you. Take care of yourself. Always happy, always smile. Good luck to you. Take care of yourself and your home members, your parents, your friends. All the best. Goodbye. Good night. Okay, all friends, goodbye, take care, good night. We'll see you tomorrow, inshallah.